Chapter 3, Lifting and Moving Patients. As an EMR, you must analyze emergency situation very quickly. Okay, quickly evaluate the patient's condition, carry out effective life-saving and emergency medical procedures, primary survey, secondary survey, treating for shock. Obviously, we're always going to do these things first. These procedures may include lifting and moving or repositioning patients. Okay, unconscious patients who have not sustained suspected trauma should be placed in a side-lying or recovery position with postural drainage. This allows the airway to stay open and reduce the chance of aspiration of vomit or any form of fluids. If the patient is unconscious, there's a good position of picture of a recovery position. Okay, the general principles for moving and patients. Every time you move a patient, you need to keep these sort of things in mind. Do no further harm to the patient. In other words, only move the patient in a way that will not cause any danger or any threat of danger to the patient. Only move the patient when it's absolutely necessary, especially when you suspect there's some sort of a C-spine injury or a spinal injury. Patients with head injuries, things like that. Move the patient as few times as possible. If you have to move the patient, move him into the position where you're going to have him when the emergency services arrive to help you. Okay, always move the patient's body as a unit. Now, this is quite strange saying things like this, but move the bodies in a straight line. Always try and align the spinal cord using those center of sternum and central pubic bone as a guide. Use proper lifting and moving techniques to ensure your own safety. You need to know your limitations. You also need to know your capabilities, and you need to be aware of how to safely and effectively move that patient. Doesn't help you get injured in the process, because then they're going to have to send an extra person to help you. Always remember safety first. As we learned in the previous chapter, safety is one of the most important things. Okay, and have one rescuer give commands when moving a patient. Always have somebody standing by to help you or to direct you, watch your footing, things like that. Okay, and when you got more than one person that's moving a patient, one person must be in charge and give commands. So 1, 2, 3. On 3, we pick the patient up. 1, 2, 3, up. Okay, also consider delaying in moving the patient, okay, if possible, until additional help arrives. Sometimes it's quite possible that you don't have to move the patient at all. Okay, only move the patient when his or your or anybody that's assisting you's life is absolutely in danger. All right. Don't step over your patient. There's always a chance of tripping and falling over the patient. We always work on the same side as the patient. We never step over the patient. And always explain to the patient what you're doing while you're doing it. Okay, keep rules of good body mechanics in mind. Know your physical limitations. Have a regular workout exercise, even if it's just something as simple as yoga, Tai Chi, something like that, Qigong. Okay, keep your feet shoulder width apart and maintain your balance with a firm footing. Use the natural curvature of your spine and do not bend at the waist. Use your muscles in your legs to lift. In other words, bend your knees. Try and keep your arms close to your body because it gives you extra strength and balance. Avoid twisting your body when carrying a patient. This could only just lead to things like side strain injuries and overbalancing. And if you overbalance, there's a good chance you're going to drop your patient. And again, only move your patient when absolutely necessary. Move them as few times as possible. There we go. It's a good proper lifting position. Bending your knees, keeping your back straight and arched, chest out, arms close to the body. Use your body strength, your core strength to move the patient and maintain balance. Okay, there we go. As I said, keep your belly back straight as you lift. Lift without twisting. Ensure that you have a firm footing before you start moving. or start to lift your patient. Okay, assess the patient, weight of the patient. You must remember that patients that are incapable of moving under their own efforts are always a lot heavier than you think they are. It's almost a dead weight. Okay, you need to know your physical limitations. If you're a small person, there's no ways you can lift 100 or 150 kilograms dead weight. Always call for additional support of personnel. Okay, and then when you're moving the patient, please communicate with the patient. Always practice your lifting a gurney, dropping the gurney, things like that. Okay, we need to ensure that all these things go according to plan, and you know exactly how well or how to use the equipment that you got to use. Some trolleys and beds and things have hydraulics where others don't. They work purely on mechanical and muscle power. Move a patient immediately in the following situations. Where there's a danger of fire or explosion, structural collapse, remember it's not safe for yourself to be in that position, so you need to move the patient out as quickly as possible. If there's hazardous materials, gases, fumes, flammable liquids, electrical hazards, things like that, it's not safe for you. Once again, definitely not safe for your patient. You need to get out as quickly as possible. If this emergency scene is not protected, if at any time that you feel unsafe, your patient is unsafe, things like that, where the crowds or masses are building up, things just don't feel right. Remember, your gut feeling is often that feeling that you have that's most accurate. Then you need to get out of the situation. It is otherwise impossible to gain access to your patients who need life-saving care. So your patient is trapped by his own disabilities in a vehicle. Okay, not trapped by the vehicle, but trapped by his injuries. You may need to get that patient out of there quickly as possible. Okay, and obviously if a patient is experiencing a cardiac arrest, you can't do CPR in a vehicle and things like that. You need to get them out of the vehicle, get them out of the bed, off the bed, out the bath, things like that. And we need to do it effectively without injuring ourselves, without putting too much strain on our own bodies. Always remember with a cardiac arrest, when ABCs fail, begin CPR as soon as possible. Okay, the easiest and simplest way to move a patient is obviously just dragging by the clothes. In some situations, you may be lucky, you might have a jacket with loops and patches sewed into the jacket, or body armor with tags for pulling and dragging and rescuing patients. Okay, otherwise, grasp the patient's clothing in the neck and shoulder area and just drag him towards you. Try and obviously keep the patient's head as still as possible, and always try and maintain neutral alignment, nose, sternum, and central pubic bone. Drag the patient until they are out of danger. All right. Cardiac patients and closed drag. If the room you find is not large enough to move a patient, drag the patient from the tight space. Quickly move the furniture out the way and begin your resuscitation. Remember, every minute that goes by that you're not effectively doing resuscitation is a 10% chance, less chance of your patient surviving. We need to get them from the bed or out of the tight space, out of the bathroom, as quickly as possible. Okay, blanket drag. If the patient is on the bed or lying with a blanket over, roll the patient onto the blanket and use the blanket to drag the patient out to safety. Carpets can be used as well and things like that, rugs on the floor. Grab them and roll them. Just remember, not too fast. If you possibly help it, make sure that you're keeping that nose, sternum, and central pubic bone in neutral alignment at all times if possible. All right. If he has no shirt or tops or clothes and things like that on, we can always carefully drag them by their feet out of the danger area. Okay, be careful the head is not bumping around, and always try and use any other way first. Arm to arm drag, in other words, you fold the patient's arm up towards his chest, stick your arms underneath his shoulders, under the armpits, and grab the arms. Using this arm grip to pull the patient forward. You also support the head and neck and shoulders. This might be a very ideal way to move a heavy patient because there's less surface area actually on the floor if you're holding his body above the grade of the ground. Okay, and as I say, it offers definitely protection for the head and neck. Okay, firefighter's drag, it's not used every day. We try and avoid things like this because we just don't want to get ourselves into trouble. People seeing you do things like this may be thinking that other funny things are going on, but one can always tie the patient's hands behind your head, neck, straighten your arms and drag the patient across the floor. This would be appropriate if you were trying to avoid smoke in a room and you were trying to be as low down to the ground as possible so that you don't choke on inhalation of smoke, hot fumes, things, then this would be the type of only time you would really try to use this type of thing. Hence the firefighter's drag name. Okay, drag from a vehicle. Okay, one rescue, grasp the patient under his arms, cradle the patient's head between your hands, and pull the patient down into a horizontal position as you ease him from the vehicle. Sometimes one might have to lower the seat. One can do so gently and remove the patient over the seat through the back door. Okay, quite easy to do it. Otherwise, get some sort of a wedge or plank underneath them so that you can straighten them out and drag them across, that type of thing. There we go. That's an emergency removal. One person grasp under the arms, pull the patient down into a horizontal position and drag them from the vehicle. All right, emergency drag from a vehicle, 2 or more rescuers. One rescuer supports the patient's head and neck, while the second rescuer moves the patient by lifting under the arms. The patient is removed with the head and neck stabilized in a neutral position. Nose, center, and sternum and central pubic bone would be in alignment. The use of longboards, if time permits. Longboards, Kendrick extrication devices, all those kind of things work very well in removing a patient in a safe and stable way. Non-ambulatory patients, in other words, they're not walking or anything like that. One rescuer grasps under the arms, removes the patient, the other one grasps the patient between the knees, and the 2 rescuers stand up and carry the patient away if possible. Okay, just remember, you're flexing lots of joints, much movement to the patient, be as gentle as possible. Okay, some of the times, some of the best ways to remove a patient is in a seating position. The rescuers would kneel on either side of the patient, brace their arms together, grasp them, amazing a seat, okay, for the patient to sit in with their arms, patient's arm over the rescuer's shoulders, and no equipment is required. Gently and safely stand using the best lifting techniques you may know, and carry the patient in the seated position away from any danger. And there we go, a good example. You could also cross your arms and carry the patient like that. Okay, cradle, like you're carrying a baby or a child, you're carrying your wife over the doorstep into the new house. Pick up and carry the patient. Kneel down beside the patient, one hand underneath the shoulders, under the arm, other hand behind the knees. Lift the patient, roll them slightly into your arms, and then stand up using your legs. Make sure you've got good balance, feet shoulder width apart before trying to get up. Okay, chair carry. One person stands behind the chair holding it by the arms while the other one tilts the chair backwards. One gives a long command and they lift and walk with the patient in the chair like that. Pack strap. Okay, patient should, it's able to stand, grasp over the rescuer's shoulders. Okay, rescuer hangs onto the arms, patient is bent forward, leaning over the rescuer and stand up and walk away. Okay, direct ground lift. This is used to move a patient who is on the ground or floor to an ambulance stretcher. Should be used with patients who do not sustained any traumatic injuries, broken bones, C-spine injuries, head injuries, things like that. Okay, please be careful when you're doing things like this. Transferring a patient from the bed to a stretcher, place the stretcher next to the bed, loosen the bottom sheet under the patient, okay, or perform a log roll onto a blanket and slide the patient on the sheet or the blanket over to the stretcher, and then slide the sheet out of the underneath the stretcher. Always make sure that you grasp the sheet firmly, keep the patient's head and chest and hips and knees still, try and keep it in neutral alignment. In other words, use a couple of people to drag or push the patient across while maneuvering the patient to the stretcher. Okay, there's a few pictures of the things. Notice 2 people pushing and 2 people pulling the patient off the bed onto the stretcher. Okay, we can always work as a one-man crutch. Okay, putting the patient's arm around your neck, holding the patient's wrist and using your free arm to support the patient around the waist and walk in a patient who can walk or move on their own steam as well, but not efficiently. 2-man crutch can also be done exactly the same way. Always remember to place your free arm around the patient's waist and help the patient move to safety that way. Wheeled ambulance stretchers, these things are awesome. Okay, one of the most common things, as I said before, one, they could be hydraulic. Okay, most of them are these days. They have nice belts and buckles where you can secure the patient once we have a blanket placed around them to keep the patient nice and warm. Always place in the position, the most comfortable position for them, and depending on what type of injuries or illness they have sustained. Okay. Stretchers can be rolled or carried by 2 or 4 people. Over a smooth surface, a wheel stretcher can be rolled with 1 person guiding the head and 1 person pulling at the foot. If the loaded stretcher must be carried, it's best to use 4 people, 1 on each corner. The stretcher must be carried through a narrow area. Only 2 people will fit. Sometimes in a stairwell, we've had to lift stretchers up and to pass it around in the air to get the stretcher around if it is safe to do so. Sometimes it's the only way to do it, technically. All right, there's a portable stretcher. These have soft covers over a rigid frame. Note that it has belts and things like that to strap the patient fast. Prevent the patient from falling out and being further injured. Remember, do no further harm to your patient. A stair chair, a portable moving device that you can seat the patient in. Okay, it can also fold down into a lightweight stretcher, depending on what type of traumas and things like that have occurred to the patient. Notice it has belts and straps to tie the patient fast, so that it's not going to, the patient can't fall out if once is seated in this contraption. Okay, use immobilization devices. Obviously, we want to use longboards, or actually these days scoop stretchers are more appropriate. These are what we use when we suspect the patient might have a spinal injury, C-spine injury, lumbar spine injury, thoracic spine, any type of time that you would have to immobilize and prevent the patient from moving. These type of things would be used along with a spider harness or a set of belts and straps. There's an old longboard, plastic fiberglass. In the old days, it used to be made out of plywood. Okay, if the patient is sustained back or hip injuries, they should be immobilized. It gets a padded cushion at the head that can be strapped fast with blocks on either side of the head, and then a spider harness would secure the patient and prevent movement and further injury. A Keds or Kendrick extrication device is like a giant pad, like a wiki pad, secure, rigid, with the white straps, buckles fitting through under the patient's legs, and each colored strap put together and pulled tightened individually. The head is also secured with the chin strap and the head strap, and it has handles. It's quite handy to turn the patient in a vehicle Once the head and neck is secured, you could push a spine board underneath the patient's behind and drag the patient out using these things and safely remove the patient in a controlled and immobile manner. All right, scoop stretches are fabulous things. They have connection devices at the bottom and the top, so patients don't really have to be moved in order to get scooped up and go. They work very well. They have positions for spider harness, for a head plate, for blocks to place around the head. Remember, when we're immobilizing patients with suspected head and neck injuries, always remember to try and support the head and neck or use a collar if necessary. Although rigid collars are no longer advised or supported in certain countries, we would still try and use maybe a soft collar just to support the head and neck. Stop it moving, and definitely head blocks the top of the stretcher. As I said, in an emergency, we can use a plank, wooden boards, ironing boards and things like that, as long as they are sturdy. Tabletops, reclining chairs, snowboards, surfboards, things like that. The thing about emergency medical responder and about first aid in general is the ability to use and improvise in the face of adversity and emergency situations. We want to be able to think on our feet. Usually the time is limited and we don't have time to faff around, to dilly-dally. We need to work quickly, we need to work decisively, and we need to save our patient and get them out of danger. Okay, or as I said, remember, patients with spinal injuries, head and neck spinal injuries, you need to use proper immobilization techniques. Otherwise, it could lead to permanent paralysis or damage. Remember, once the patient's head and neck is in a neutral alignment, we must use blankets or head blocks, things like that, to manually stabilize the head, the foam blocks. If while we're moving the patient, we at any stage get numbness or tingling in the limbs, sharp pain, muscle spasms, if we hear crepitousness of bones and rubbing against each other, things like that, immediately stop what we're doing and try and immobilize the patient's head and neck in the position we found it, so that you are no longer causing any danger to the patient. Remember, cause no further harm. Okay. With any patient that has been in a vehicle accident or has a spinal injury, we want to make sure that we have the correct personnel, the correct equipment, okay, and the correct techniques to move that patient, so that we don't cause paralysis or even death of that patient. All right. Only remember, when spinal injuries, use the patient move him as a unit, nose, center of pubic bone and sternum in alignment. Always transport the patient face up, supine, and patient's head and neck must always be in a neutral position. As I said, be sure the rescuers understand what is to be done before attempting any movement. Okay, one rescuer gives commands, the one at the head, the one in charge. Okay, backboards or things like that. Now, with a backboard and that type of thing, we need to use a log roll. Log rolls are always directed by the rescuer at the head, the rescuer is in charge. Always follow his example, always follow his commands to the T. Okay. A question or patient movement commands have two parts, a question and an order. Always move the patient as a unit. Keep the patient's head in a neutral position at all times. If the patient rolls, the rescuer rolls with the patient, or the rescuer moves the head in the same time or position as the patient rolling. Straddle lift is also very effective. The patient doesn't have to be rolled at all. Head and neck can be kept in alignment. If the rescuers are comfortable enough to get down and to as a unit, lift the patient once, a board can be slid in underneath the patient and there can be no complications. Quite easy to do. One on the head and neck, obviously lying down, trying to get down on the level of the patient, down to grade. One straddle the shoulders to the chest, one straddle the hips, one straddle the legs, and one to obviously insert the backboard. Log rolls and straddle lifts, they should be practiced often. Okay, it's teamwork. You never know who's in your team, so the more you practice, the more people get used to each other. There's another type of straddle slide, hardly lifting the patient up off the ground. The board is slid into underneath the patient, and the patient is secured to that board. Okay. If you have to slide the patients about 25 centimeters at a time, about 10 inches to 12 inches, about a foot. Straps and harnesses, I've spoken quite at length about spider harnesses. Always remember when removing a spider harness to reattach the Velcro at the same time. Otherwise, spider harnesses end up in a tangle, and next time you need to use it, the patient might have to wait 3 or 4 minutes or 5 minutes, which might cost them their lives. Remember, time counts. So always keep your stuff in a neat, orderly fashion that could work the first time for you. There's a good example of straps and strapping techniques. Once the patient is on the board, the head blocks are in place, chin strap in place, head strap in place, then you may continue to strap the rest of the body into position. Patient at the head, the rescue at the head of the patient never ever leaves the patient's head until it is immobilized completely. Okay. There we go. There's a good few examples there of patient head immobilization, collar in place, rescuer still holding the head while the blocks are put in next to the patient's head and the ears, okay, and then strapped fast on the forehead and under the chin with the straps provided.